And now here's our reporter Laura Windsor with some important information.
Millions of women suffer from vaginal prolapse. In fact, 1 out of 2 women over age 45 suffer from some kind of prolapse. Here to explain the causes and treatment for this condition is Dr. Lorenzo Apodaca of Redlands Community Hospital in Redlands.
Basically, this is something that tends to occur after childbirth, in particular difficult childbirth, but it can also be congenital. That is to say, you're born with it, and the amount of collagen that you have tends to attenuate, and therefore the pelvic structures start to fall. It also may occur with certain kinds of medications, in particular patients that are on steroids, that will also attenuate the pelvic anatomy. And also patients that tend to do very strenuous exercises, lifting 100, 150 pounds, that can also weaken the pelvic structures.
Dr. Apodaca describes the symptoms.
The mild degree of asystocele, which is the bladder dropping, tends to be some pressure discomfort, also difficulty sometimes voiding, and also these patients sometimes tend to have an urgency because sometimes they can't quite empty their bladder, and therefore they're constantly looking for a restroom because they find themselves going to the restroom quite often. The more severe form is when the bladder is coming outside the vagina. These patients tend to have a difficult time emptying their bladder. They actually have to manually reduce the vagina in order to be able to empty their bladder. And even then, they can't quite completely empty their bladder, so they find themselves going to the restroom quite frequently. They also suffer from pain with intercourse. The bladder's right there in that area, and it can cause quite a bit of pain. And also, with increased physical activity, by the end of the day, there's a pressure, soreness, fullness type of discomfort that the patient starts limiting their level of activity because they know that towards the end of the day, they're going to have that type of discomfort. When I see them, usually it's having a significant impact in their lifestyle. They've been able to live with it, not talk too much about it, but then the symptoms start occurring, their primary doctor sees them, and then they'll refer them to us, and that's when the patient tells us their whole story in tears, usually.
We asked Dr. Apodaca, how is vaginal prolapse treated?
There are conservative treatments, and then there are surgical treatments. The procedure, which is a sacroabdominal colpopexy, usually will take between 1 to 1.5 hours. It's a small incision that's made a bikini type of incision, what we call an ultra mini laparotomy. And usually the patients are in the hospital for 3 days. The recovery course, after 4 days, we strongly encourage them to start walking anywhere from 1 to 3 blocks. By 2 weeks, they can start going on a vacation if they wish. And by 4 to 6 weeks, they're back to their normal activity. In terms of sexual activity, they can resume sexual activity in 6 weeks. This basically has about a 98% success rate, and it's quite effective over their lifetime. We put everything anatomically back to where it belongs, so nothing is cut, and basically you have a normal functioning vagina, and your sensation will be back to what it has been because there's no cutting at all.
Millions of women do not have to suffer with vaginal prolapse, especially when treatments are available, but they need to talk to their doctor. I'm Laura Windsor for the American Health Journal.